This is one of the easiest and fastest ways to improve your breathing tonight, especially if you find it difficult to breathe through your nose. Now, this is something I've talked about before, nitric oxide, right? And if it's your first time, welcome. But I do want to give an exclusive upgraded exercise around this. All right. That's what we're going to dive into over here. And of course, this is for educational purposes only. Talk to your doctor to make sure breathing is right for you. So in this study, they looked at levels of nitric oxide in people, and the people with the most, that is, if you look at my mouse cursor over here, that's the group all the way to the right in all of these graphs here. So I'm going to look at the graphs, which will make me look like I'm carrying off into space. So as you can see, total sleep time greatly increased when nitric oxide is higher. You're having fewer wake ups at night. You're falling asleep faster. That's with sleep latency. So sleep latency is lower. And as a result, your sleep efficiency is higher. All good stuff. And that's why that study shows there is a statistically significant correlation between how much nitric oxide you have and your sleep. So I just wanted to give you some assurance that nitric oxide is indeed a very powerful thing. And I'll give you the exercise in just a moment here. But I also want to be clear how this can also result in fewer apneas and less snoring. So a big part of sleep apnea, obstructive sleep apnea, is you got weak floppy muscles in the back of the airway here. They get pulled by this faster, more irregular breathing pattern at night that causes airway collapse. So obviously, the more we can do things to slow things down in terms of the breathing, we're not going to talk about muscles today, but the more we can slow down breathing, the better and more open your airway will be. So there's two ways that nitric oxide helps out with that. So number one is that nitric oxide, in its essence, is a vasodilator. That means makes blood vessels bigger. So the reason this works is that when you're able to have changing levels of CO2, because you have greater transport, that'll help program your brain to tell your body to breathe at a correct rate. If you have poor transport, that means CO2 just piles up and doesn't really change at all. That will actually blunt your body's innate ability to have your brain tell your body how to breathe. So, thus, having more blood flow around your lungs allows CO2 to go up and down and to allow us to have slower, steadier breathing at night. Okay, don't get caught up on like absolute levels of CO2. The change is important, and nitric oxide allows that a lot better. Like if you look at this up top, well, they're both really blurry, so that's great. But up top is like normal flow. And then if you introduce nitric oxide into the mix, there's more blood flow. All right, that horse is not coming back. So the second big way that nitric oxide helps is by increasing the size of your airways. It's pretty simple. Think of your airways like a straw here, and you have smooth muscles around it. That's what this diagram is representing, but it's like a slice through this way, so it's somewhat hard to conceptualize unless you're a total nerd. Nerds unite, right? So what happens, you have your airways, right? And then there's muscles around it. If those muscles are tighter, your airway is smaller. Now, if your airway muscles are more relaxed, this is bigger. If you have a bigger airway, it will allow for slower breathing because you have a bigger space. Think of it the opposite way. If you have a straw and you're trying to breathe the same amount, you're going to breathe faster, right? Now, what that looks like is, so this was an experimental setup. They used drugs to make the airway small and then drugs to make it big, just to accelerate the process. And what they found is that when you allow for nitric oxide to work, and when they did that, they actually increased the size of the airway by 50%. And how that actually pans out, that leads to about like a 16-fold increase in airflow. So pretty important. You may be wondering, okay, cool, we're gonna raise nitric oxide. How's that gonna help me breathe at night? Good question. So your brain tells your body, your lungs, or really your diaphragm, at what rate we're going to breathe and work. That's great. That's awesome. But the thing is, it's really like a program that gets created. Very important because when you do these breathing exercises tonight, about like an hour before bed for 5 to 10 minutes, it will have an immediate effect. And then that is going to program your brain to maintain a certain way, pattern, and speed of breathing. All right. So it carries through the night. So that's the important thing I wanted to show there. So enough of the science, blah, blah, blah. Let's get into practical things. Now, the reason I call this a 10-second nitric boost, because obviously we've gone a little over 10 seconds here, but this is from a paper where they had people hum for 10 seconds And this was the boost in nitric oxide. Let me zoom in here so you can see a little bit better. Okay. As you can tell, it goes way up. So this person went from, let's just say, 50 parts per billion to like 1,000 parts per billion. We don't know the math on that, but it is certainly more. All right, they're still running the calculations in next to CERN there. Now, there is another thing. That's why I wanted to add to this because I've talked about humming before, but there's a way to make this even more effective. So, nitric oxide will also be produced when your airways are stretched. Okay, it will get bigger when you stretch. That's why when they look in the research and people do deep inhales, that will also increase nitric oxide. So, together, what that looks like. This is all going to be through your nose, by the way. So it's going to be a 5 count and actually a maximum inhale. Usually when I say inhale or exhale, it's just a slow and steady. Here is going to be a 5 count maximum. So like really take in a deep breath. And as you're practicing that, I also want to remind you, talk to your doctor about whether this is appropriate or not. This is for educational purposes only, right? So that will help with the nitric oxide production in that way. And then as you exhale, you are going to hum. So with your mouth closed, do that for about a 10 count. And then you're going to cycle through that for 5 to 10 minutes. So as you do that, that will help produce more nitric oxide at both levels. And then the other good thing is with the timing of that, because there's a reason I have these times kind of longer. And I mean, honestly, I was thinking about making the exhale even longer, even adding a pause into there. But, I know at YouTube, we're at a very, beginner level for a lot of these exercises. But you also increase your body's CO2 a little bit. And then you have, like I said, that big swing in CO2 that helps sort of reprogram, resensitize your brain correctly to the correct breathing patterns. That also is a big benefit of this exercise. So the more you can get that exhale or even add in a pause, totally up to you. But that would be the baseline there. So the best way to use this, I would say definitely before bed, 30, 60 minutes. Now, if you are someone who struggles to nasal breathe, the more you do this, the better your nasal breathing will be. There's really not a whole lot of workaround about this. There actually is a case study where someone did like humming for like an hour every single day and it cleared up their rhinitis or their nasal congestion. So the sky is the limit here. I guess the nose is the limit, actually. And speaking of segues and limits, if you haven't already, check out the Peckus breathing program. That should be somewhere on the screen or in the description, a little link there. But basically what we dive into there, get you a personalized breathing protocol so you're on the right spot in your breathing journey so you can make the most progress in the least amount of time. So check that out. Link on the screen here, there, somewhere, or just go to ochnow.com/program because I know 40% of you are on a TV. Well, I'm on the TV. You're watching it on TV. Rather interesting. So you can get your phone, go to ochnow.com/program to check that out. Okay. And again, there's a button somewhere. So thanks for watching. Give it a go. And I'll see you soon.